everyone, and welcome to Your Health, Your Choice. I am Dr. Roopnarine, and on tonight's program, we are pleased to bring you an introduction to the field of obstetrics and gynecology. I'm very honored to have in studio with me tonight Dr. Roshni Bissoondat, who is a consultant in the field of obstetrics and gynecology. Tonight, as usual, our numbers in studio will come up at the bottom of your screens, and tonight we shall do our very best to address your questions in the final segment of the program. So thank you very much for joining us. And without much hesitation, I would just like to say hello to our guest, Dr. Roshni Bissoondat. Hello, Roshni. How are you?
Hi, Robin. Good night. Thanks for having me on tonight.
Yeah, you're very welcome. And it's a pleasure for us to have you. And Roshni, I have someone who has known you for many, many years. However, if you could just introduce yourself to our guests at home. You know, if you could just tell us a little bit about your training and your qualifications, your postgraduate work, and where you work at the moment.
Okay, so I graduated from the University of the West Indies, St. Augustine. Mm-hmm. Then I went on to do my internship at San Fernando Hospital and also worked there for 2 years.
Right.
I then decided to do my postgraduate training in England. So I started off in Manchester. Then I came down to what you call the Eastern Deanery. Yeah. Which is the Cambridge Deanery. So I worked in places like Luton, Peterborough, and then finally in Cambridge.
Right.
So then I completed my full training in England and then decided Trinidad is the place I wanted to be.
Yeah.
And I decided to come home.
Right.
So then when I came home, I worked at San Fernando Hospital as a consultant there for 2 years.
Okay.
And now I work at Southern Medical Clinic and also the other hospitals in San Fernando, such as SurgiMed as well, and sometimes in Gulfview.
All right. So how many years have you been back in Trinidad working?
Since 2008.
Okay, very well. So, Roshni, a lot of our viewers at home, it's a family kind of crowd that looks at the station ACTN, and we have a lot of medical students and a lot of teenagers who are there at home with their parents watching the show. So just to give them a little idea, why did you choose to do obstetrics and gynecology, and why are you passionate about the field that you have chosen?
Okay, so first of all, it's a woman's field.
Yes.
And as you might know that women's health have been overshadowed. You know, it's been at the bottom of the list, and I think it's time for us to really make people aware of women's health.
Agreed.
Even women sometimes feel that their symptoms, they're made to feel that their symptoms they're made up, it's all in their head. And it's time for us to really let people know that the way you feel also reflects in your physical appearance, the way you feel. So again, women's health is very important in that way. It has been a male-dominated field, and some women just feel uncomfortable speaking to a man, and sometimes they don't want to say everything. So again, it's in my field, I think being a woman, we kind of help in a little more because women are more some women, I'm not saying everyone, they're more comfortable coming to you and talking about their symptoms and their concerns, and they sometimes feel, you know, we can relate to them a little more.
Can I ask you, did you want to do obstetrics and gynecology even before you went into medical school, or was it in medical school that you thought?
It's actually in medical school I realized I wanted to do it.
Okay.
Yeah.
What was the trigger in medical school that made you want to do it?
Funny enough, I thought it was the best rotation that we had. And my teachers really made me choose obstetrics and gynecology.
Okay. Yeah. Okay. Well, this weekend, I kind of touched base with you, right? And I was telling you, look, Roshni, you know, I want to bring the message of obstetrics and gynecology to our viewers at home, to my patients. And one of the fields that I thought that wasn't being explained well enough or wasn't being spoken of enough in the public domain was that of menopause. And so therefore, I think you were pretty keen to discuss menopause, and I'm glad to have you here to go into that field. So can I just ask you, Roshni, for the benefit of all of us at home and here and myself, what exactly is menopause, and what symptoms do our patients complain of with menopause?
Okay, so menopause is when a woman stops seeing periods. And this is because you have no more eggs remaining in your ovaries, and therefore you have no more estrogen being produced. Now, the average menopausal range is between 45 to 55.
Okay.
But it can, in the majority of cases, occur around 51 to 52. And that's based on UK data because we don't have data in Trinidad, unfortunately.
Right.
But menopause itself is only defined when you stop seeing a period for 1 full year. So you have to wait until that time to then say, well, okay, you're now menopausal. Okay. Right? Now, there are quite a few symptoms of menopause. Right. The most common ones that most women will know would be things like hot flushes, night sweats, vaginal dryness, thinning of your skin. And then there are some other atypical symptoms as well. Such as some people will get shooting pains in their legs.
Because I think you were telling me that there were some like 34 or 35 different symptoms.
Yes, correct.
So sometimes women will come to me in my practice and they'll be like, Robin, I'm feeling this symptom or something out of the ordinary that's not only typical 5 or 6 symptoms such as hot flushes and night sweats that you described. If you could just go through, I mean, it's something that you wouldn't have at the top of your head, but then we have your laptop there with you. If you could just go through the full range of symptoms and bring it up on screen. Okay, great. And if you could just explain a little bit about each symptom first, please.
Right. So the most common symptom would be hot flushes. And hot flushes is due to fluctuations in your estrogen. And most women might feel hot, sweaty, flushed. And it's typically in the head, neck, and chest. Some women also may experience chills. The second would be night sweats. Now, night sweats is the same as a hot flush. However, it occurs in the night. Scientists aren't quite sure what it actually causes, the night sweats, but they feel that it's falling levels of estrogen that affect your hypothalamus, which is an area in your brain that and that's the area that regulates temperature control. So there's some trigger that estrogen triggers the hypothalamus. The next symptom would be irregular periods. And as you know, coming up to menopause or the perimenopause, women will start skipping periods.
Perimenopause is what phase?
Perimenopause is the first phase, which is, it's a range. So anybody over the age of 40 is actually perimenopausal.
Oh, wow.
Yeah. Okay. But then you may not become menopausal for 10 years. But you're still considered perimenopausal. Right. So the irregular periods could start from the perimenopause. Right. The typical symptom would be skipping of periods, and that's natural. Right. Some women do have more than one period, but we tend to be a little more cautious of that because other conditions could cause irregular periods, and the most worrisome one would be cancers. Right. So we tend to not ignore the frequent periods, heavier periods. Right. It's more typical for you to skip periods.
Right. If you could give us some of the symptoms, because what I'm pretty keen for the audience at home, they had the full gauntlet of symptoms. Okay. Because they're at home and they might have symptoms, and they might not be feeling well, and they might not be sure whether this is menopause or not. So, I mean, it's going to take a little bit of time, but I want you to actually give as much symptoms as
34.
possible.
Okay. Yeah. So the fourth, mood changes. So this can be unpredictable, and it's actually not related to your life events. So it's out of sequence. You could be feeling sad, moody, weepy. The next would be breast soreness. So breast tenderness are very common. Decrease in libido. This is very common. Again, this is due to lack of hormones, but the main hormone is testosterone, right? Not the estrogen, but testosterone. Okay. 7 would be vaginal dryness. Again, this is due to decreased blood flow to the vulval area due to lack of estrogen. Headaches. Some women who enter the menopause experience more headaches and migraines, and this is very common to the premenstrual headaches that women get as well. Okay. Tingling of the extremities. This is one of the atypical symptoms. Right. And typically it's in your hands, feet, arms, legs. Right. And this is the result of the hormonal fluctuations that affects the brain, right? And it only lasts for a few minutes. Right. Then there's burning of the mouth. This is another potential symptom of menopause, and women feel this as burning, tenderness, tingling, numbness around the mouth as well. Okay. changes in taste. Some women actually find that their sense of taste is heightened, especially to strong flavors.
Why is that?
It's because this may experience because of the hormone in the mouth. The mucous membranes have what you call the sex hormone receptors. Okay. So you become more heightened because of that those changes.
So they have what, a greater sense of taste?
Of taste.
Wow.
Yeah, and because of the same hormonal change, you actually become more at risk of developing gum diseases and cavities. Okay. And the dryness. Okay. Then there's fatigue. Fatigue can be very distressing and sometimes debilitating. And this could be the result of your lower quality of sleep due to your hot flushes and night sweats, but also the hormonal fluctuations. Then there's bloating. I mean, so many women complain of bloating.
That's probably one of the most common symptoms that people complain about.
And they could get this for a number of reasons. Some could be due to fluid retention, just the greater production of gas in the bowels, slower digestion, because hormones help with digestion. So if you have lack of your hormones, digestion is actually slower. Okay. And then stressful situations also can make you more bloated. And in the menopause, the change from pre-menopause to menopause, some women are stressed, and that affects your bowels as well. Okay. They can have other digestive symptoms, and this is influenced by your normal, what you call microbes or bacteria in your gut. Right. So that's one of the reasons for other digestive symptoms. Another common symptom would be joint pains. So estrogen in itself helps to decrease inflammation, and this keeps your joints lubricated. So therefore, if you have less estrogen, you're less lubricated in your joints, and you tend to get joint pains. Right. And then there's what is called menopausal arthritis. Right? Okay,
what is menopausal arthritis?
It's the same thing. It's due to the estrogen causes decreased lubrication in your joints. And, you get your joint pains because of that. Okay. Muscle tension and aches, same principle due to a lack of estrogen. Right. Then you get electric shock sensations. This is uncommon, but I've had women that came with these symptoms. Okay. And this cause is not clear, but again, we think it's just the changes in the hormonal levels within your nervous system. Right. Itchiness. Itchiness, estrogen helps with collagen. So when you have lack of collagen, that causes your skin to become less hydrated, becomes dry, and dryness of your skin causes itchiness. Right. So, and that could be mainly in the vulval area, but you can also get it in your entire body.
Is that a common symptom of menopause?
Very, very common symptom. And women come to the office thinking that they actually have yeast infections due to itching, but it's not itching, it's menopause. Okay. So be careful when a menopausal woman comes saying that they have itching, because it's most likely menopausal rather than a yeast infection.
Hormonal.
Hormonal, yeah. Okay. Then there's sleep disturbances. So sleep tends to be lighter. A lot of women have insomnia, so they can't even fall asleep. They sleep very light. And then the hot flushes and the night sweat. So then you have, your sleep is very disturbed.
Can I ask you a question? Do you have women that come in without hot flushes and night sweats who actually, is it that they must have hot flushes and night sweats? Because I believe that's what a lot of people in the public think, that without the hot flushes and night sweats that you don't actually having symptoms of menopause.
No, and that's incorrect, because as we said, there are 34 symptoms and you don't have to get all 34. Right. Some women get none and some women get various ones. And while the hot flushes is common, you don't have to get it. You can get all the other symptoms. Okay, so you can continue on with the rest of the symptoms, sorry. So then there's also difficulty concentrating, and a lot of women have this. They feel foggy, difficulty concentrating. And again, this could be hormonal, but it can also be due to lack of sleep, the hot flushes, the night sweats. So again, lack of sleep causes you to difficulty in concentrating. Memory lapses as well. So this is number 21. Right. As with concentration, menopause affects your memory, and it is a direct effect of lower estrogen levels. Wow. Previously, it was thought that it was correlated with Alzheimer's, but we know it isn't. Okay. You can have memory lapses, and it has absolutely nothing to do with Alzheimer's disease.
Okay.
It is just a symptom of menopause.
Okay. Does those symptoms abate, or
They can,
memory
yes.
lapses?
Yes, they can. Okay. But some people will have it for two.
Lifelong?
Yeah, some women.
But generally, like the memory
Most
lapses,
times they do go away.
After how many years or?
It's about 2 to 3 years of the memory lapses.
So women tend to feel better with the symptoms of menopause 2 to 3 years
And sometimes
after?
with treatment.
Okay. So maybe I preempted a little bit of what you're saying. I apologize. You can continue on with the rest of the symptoms.
Okay. So the next symptom would be thinning of your hair.
Right.
Now, your hair also has estrogen. So hormonal fluctuations cause your hair follicles to actually shrink, and the hair grows more slowly and then also sheds more easily.
Wow.
Also, they have slight fluctuations in your testosterone that causes hair loss.
Okay.
Then you can have brittle nails.
Yes.
And this is due because your body normally produces keratin, and it is also estrogen dependent. Lack of estrogen causes less keratin to be produced, and therefore your nails can break easily. Next symptom, very common, weight gain. And this could be due to many factors as well. First, a decline in the estrogen definitely has been linked to weight gain. Also, less physical activity. Also, remember, mood changes affect your activity as well. So that is another symptom. Stress incontinence. This is when you leak urine. So if you cough, laugh, sneeze, you literally could leak urine. Right? And we could go into that later on.
Right.
Dizziness, dizzy spells. We do know that in the menopause, insulin levels, they change, they fluctuate.
Right.
And this fluctuation in insulin levels cause women to become dizzy because you're not maintaining your sugars enough.
Right.
Allergies, they're more heightened as well. And this is due to an increase in your histamine levels. And histamine is what causes allergies.
Okay.
Osteoporosis, very, very common. This is thinning of your bones. And estrogen has a major impact on osteoporosis.
Of course.
And osteoporosis could lead to then fractures.
Right.
An irregular heartbeat is your next symptom. It could be irregular, you can get arrhythmias, and it's very common in the menopause. But you do have to be very cautious because while it could be menopausal, again, age-related, you must consult a cardiologist to rule out a cardiac issue. Body odor. The body odor is due to sweating, and this is directly linked to your hot flushes, your night sweats. Irritability. So it's due to hormonal fluctuations as well, and while women go through this change, they're just uncomfortable with their symptoms. So irritability is one. Leading on from that is depression. It's very common. And the hormonal imbalance is what triggers the depression. Sometimes it is situation. It's triggered by your life changes. But however, your low mood also can lead to this, right? Anxiety, very common, and it tends to be worse at night. So it's slightly different. And then the last is a panic disorder.
All right, great. So, Roshni, that's a perfect time for us to take a break. I think we've gone through all 34 symptoms. So we'll take a little break, and we'll be back in one moment.
ACTN The Voice welcomes you to join us for our newest agricultural television series, Harvest. You can look forward to a personalized tour around scenic Trinidad and Tobago, showcasing different agricultural practices and teaching us self-sustenance. Explore the many ways to make your harvest right for you. Join us every Tuesday at 6:30 p.m. Harvest, a new dimension in agriculture. Sponsored by Munich Home and Garden, the Agricultural Development Bank, and the Plant Doctors.
Welcome to the Chuttock's Kitchen, where it's tastier and spicier. For even more taste, cook with Chuttock's Amchar Masala, saffron, ground jeera, and black pepper. Mix in Chuttock's mild, spicy Madras curry. Get a burst of excitement with a mango amchar, homsade and mango kuchila, lime and pepper chunks, West Indian hot sauce, and lime pepper sauce. Plus, Chuttock's tamarind and mango chutneys are perfect with kalori and sahina. So make your kitchen a Chuttock kitchen. Chuttock's fruit products, bringing good taste to life.
It's December 24th.
Right here on the evening show, we'll be having 12 days of giveaways. And the rules are pretty simple, Kimberly.
All you have to do is watch the evening show every day at 6 p.m.
Yep, for a chance to win big this Christmas.
Munich Home and Garden specializes in hardware, paint, home decor, tools, agricultural supplies, pet supplies, car accessories, appliances, and much more. Located at Val Park Shopping Plaza, Atlantic Plaza, Point Lisas, and Eastern Main Road, St. Joseph. Shopping comfort with our well-secured outlets. Call us at 663-5163 or visit the Munich Home and Garden Facebook page or www.municht.com. Munich Home and Garden, where we make shopping a fun experience.
Stop the rising cost of food now. Grow your own food. Provide for your family and earn an income with Plant Doctor's Hydro Aqua of number 30 Matilda Road, Princestown. Grow safe, clean, and organic with your hydroponic supplies, organic potting soil, fertilizers, pesticides, and seeds. Let us help you grow and earn. Call 379-6710 or WhatsApp us at 372-9440. Plant Doctor's Hydro Aqua. Let's grow TNT together, one plant at a time.
Hey guys, welcome back. Welcome back again. We have Dr. Roshni Bissoondat with us tonight, and we are discussing menopause. So I just want to remind you all that you could send in your messages and you could call in, and we will address the questions at the final segment of the program. So, Dr. Bissoondat, I think I achieved a major goal tonight by giving the patients at home the full gauntlet, but not only the full gauntlet, but an explanation and the logic as to why they have particular symptoms. Because once someone understands the logic of why they're having certain symptoms, then they could go ahead and relate what is happening to them, and it makes sense. So I just want to move on to the treatment of menopause. If you could just tell us, well, first of all, is there any investigations that could be done? And if you could give us some of the natural treatments for menopause.
Okay. So anybody over 45 who is skipping periods, you can generally make the diagnosis of perimenopause, and if their periods stop, then you can say they're menopausal. However, under 45, you have to be cautious because there are other conditions that can cause skipping or stopping of periods, such as thyroid issues, high prolactin, and polycystic syndrome. So you cannot assume that it's menopause.
Okay.
The blood test that we would do in somebody, in a younger person, is called your FSH level. So yes, you can do that. But for older women, especially close to 50, there's absolutely no need to do that blood test because your symptoms and your age alone helps to make that diagnosis.
Okay. Diagnosis is purely based on, well, generally based on history.
The history of stopping of periods, yes.
So us as practitioners have to be very good listeners.
Yes, and you definitely do not have to do a blood test to diagnose menopause.
What treatments do you normally give to patients who are suffering the symptoms of menopause?
Right. So if we could
start with natural treatment.
Right. So first of all, lifestyle changes.
Right.
Diet and exercise. And the exercise could be things like your aerobic exercises and yoga, low intensity exercises. This increases your metabolism and it actually helps to produce your normal endorphins that makes you feel better.
Okay.
So that's your first line treatment.
Right.
Second line treatment is also in terms of diet, reducing your caffeine intake and alcohol intake. Because that actually helps to decrease your incidence of hot flushes and night sweats.
Obviously.
Yeah. There are other natural hormones, which the natural hormone is estrogen, but they're very tiny, minute doses in St. John's wort, black cohosh, something called isoflavines, yam, they all have minute amounts of estrogen in them. Yeah.
Okay.
And although medically we would tell you, look, that wouldn't work.
About evening primrose oil.
Okay, so while women use oil of
I think
evening,
that's probably the most common
thing used
in Trinidad in my practice that I see women use
right,
for menopause.
but
I didn't hear you mention it.
no,
So
because
there must be a reason.
right,
Yeah.
because we have done studies on it, and this is again I follow UK data,
Right.
and the UK data didn't show a benefit of oil of evening primrose
Okay.
for menopausal symptoms.
Okay.
It really helps with premenopausal symptoms. So women before menopause, it has been shown medically and scientifically to work, and especially with breast pain.
Right.
Yeah.
That's a very valuable piece of information.
Yes,
for our viewers,
because
I think.
many women actually go on oil of evening primrose for menopause when the better option would be the black cohosh, the isoflavines, and that sort of stuff, which it's actually sold as natural hormone replacement therapy.
Right.
Right. Other treatments would be acupuncture and acupressure, and this has definitely been proven to help with menopausal symptoms. Something called complementary therapies, which we aromatherapy, right? But we need more data into this. Then you have other non-medical treatments, especially for hot flushes and night sweats. They are actually high blood pressure medications. And then there's the psychological treatment, which we know as cognitive behavioral therapy. So those are the more natural ways of treating menopause. I don't know if you want to go into medical treatment now.
Yeah, go ahead.
So the medical treatment would be what we call hormone replacement therapy or medical hormone replacement therapy.
Right.
As I mentioned before, there's the natural hormone replacement therapy. The dose of that is actually about 1,000 the dose of medical hormone replacement therapy. However, women swear by it. And I've had some of my close friends using it, and they're like, yeah, this thing works. So your first line treatment is really probably the natural hormone treatment.
Right.
Right? In terms of the actual medical hormone replacement therapy, there are various ways of taking it and different formulations. So somebody who has a womb or a uterus, you have to give them estrogen and progesterone. Somebody who's had a hysterectomy or removal of their womb can use estrogen only as their hormone replacement therapy. Okay. Right?
Can I just interrupt you on this? I just want to give you a little question from left field there. When I was in medical school, right, the gynecologists were, I'll be real honest with you, they were really anti-hormone replacement therapy when I was in medical school, right? I graduated in 2002. And in Ireland, they were very anti-using HRT because they said that, listen, you had increased risks of cancers, basically. So I think some of that kind of carried over into the current generation of practitioners and patients. Can you clarify that whole issue first, please?
So that is actually correct in what you were saying, because there were some big studies that were carried out, which was called the Million Woman Study, and that's the WHI study. And it actually showed initially that there were increased risks of breast cancer, strokes, and cancer of the lining of your womb.
What years was this study done? You don't remember?
I can't remember.
That's all right.
I can't remember.
Because it was... Yeah.
But the unfortunate thing with it is in the initial published data showed side effects. But then they realized that the studies were done on women that were over 60.
Right.
And then they redid the studies in women between 50 and 60. And actually they've now changed the thoughts on HRT.
Very good.
And it's actually been shown that HRT is safe between the ages of 50 to 60.
Okay.
Now, the risk we talk about of breast cancer, it's really after 5 years of using the combined HRT, which is estrogen and progesterone.
Right.
There's absolutely no increase of breast cancer using estrogen only.
Right.
So women who've had hysterectomies, there's absolutely no increased risk of breast cancer. Okay. And then also this, when we talk about the 5 years, if it's dose dependent, in other words, if you stop using HRT, your risk of breast cancer decreases. So it's pretty safe to use HRT for 5 years. And most women would probably need it between the ages of 50 to 60, and it's safe during that time.
Okay.
The other risk is cancer of the lining of your womb. Again, so this is why if you use estrogen only, then that's when your risk of cancer of the lining is increased, which is why the formulation of using estrogen with progesterone decreases your risk. So the risk is very, very minimal using that combined type.
So logically, the most common type of HRT is combined.
Is the combined type. And again, 5 years, that's when your major risk increases. And again, the risk of, they stopped the study because of the risk of strokes as well.
Right.
But that's because, again, the women were over the age of 60.
Right.
And naturally, age-related, you are already at a risk of getting strokes.
Right.
So again, when they redid the studies, they realized the risk of stroke is very minimal between the ages under 50.
Right.
And then your other risk factors would be hypertension and obesity.
Okay.
So again, if you do, and smoking.
Right.
So if you don't do any of those things, your risk of stroke is very minimal.
Okay.
Right?
So is it that when patients come to your office in general, I mean, I don't mean to put you on the spot, certainly we're not holding you to that, but is it that you would try natural formulations first?
Yes, I actually do. I do.
Or is it that you would say, listen, HRT is safe, and natural formulations are fine, but let's try the HRT. Or
I always go first.
What would you do as a practitioner?
Well, as a practitioner, I always go first with your natural remedies.
Right.
So go with your diet, your exercise, you're decreasing your alcohol intake. And I actually do prescribe the hormonal. Right.
Not your evening primrose. But
I don't use evening primrose. Right. However, if someone tells me that they use it and they feel better, great. Go ahead and use it because there's no negative effect of using oil of evening primrose.
Okay.
Right?
All right. And obviously, when the patient is on HRT, do you monitor them for these cancers?
Yes. So you have
because
to
it would be an
seen.
absolute tragedy if someone develops a cancer on HRT.
So for breast cancer, as a normal routine over 50 anyway, you're supposed to be doing your mammograms, plus or minus a breast ultrasound
Can
if
you repeat
needed.
that? Because it's very important information for the crowd at home to hear as well. What is the screening age for breast cancer?
So normally we start breast cancer.
A little bit from the HRT treatment, but tell us about breast cancer and breast cancer screening.
Okay.
Let's give us the guideline.
Right. So the guidelines, you start doing mammograms from the age, so there are American guidelines and then the English guidelines. So Americans start at the age of 40.
Yes.
The English tend to be a little more conservative, and they definitely start at 50.
Okay.
But if you have a family history of breast cancer, you might need to do a mammogram a little earlier, or even a woman in their 30s will do a breast ultrasound.
Right.
And what women need to know is that breast cancer increases with age. So it is actually age-related. So it's important for you to get screened most women will start at 40. It can be every 3 years initially, but after 50, it then becomes more...
every year?
It could be every year to
the rest of your life?
No. So again, studies have shown your risk of breast cancer is major until the age of 75. So you can... if you don't get breast cancer by 75, your risk actually decreases, although you can get it after 75.
Okay. So we're starting this patient on HRT treatment. They've tried the natural treatment. They're now coming to you. You're going to put them on some HRT hormone replacement, which is a combined replacement. This is a pill, a plus or minus, creams, gels.
Exactly. So there are different ways of taking it.
Right. And we're also screening them for breast cancer. And any other type of cancers we're screening them for?
It's not necessary to screen for endometrial cancer, but doing an ultrasound is actually once done by somebody who's very good in doing ultrasounds.
Yes.
And what you call the endometrial lining, which is the lining of the womb, is less than 4 millimeters.
Yes.
That's actually very low risk of endometrial cancer.
Okay.
So you can do an ultrasound. It's not necessary to do a biopsy.
Okay.
So, yes, the mammogram, the biopsy.
Right.
I'm sorry, not the biopsy, the ultrasound. And you still do have to do your blood screening because there has been slight fluctuations in your cholesterol and your triglycerides.
All right.
All
right. So we screen our patients as we start them on the HRT hormone replacement.
Correct.
We try them with natural first, and now we're moving on to the HRT, the combined HRT. What are the what are the modes of delivery for this
Right.
hormone? So that is, what do you prescribe to patients? Gels, tablet? Is there a difference?
Right.
What should a woman use?
So, unfortunately, in Trinidad, we really only have the tablet forms.
Okay.
Which we have what you call the continuous combined, which is the type that you give women once they've stopped seeing a period over more than a year.
Right.
And it's a daily pill.
Right.
So it has to go through the gut system and be absorbed. So that's when you actually have your increased risks because of an oral tablet.
Right.
But there are gels available, there are creams available.
Just not in Trinidad?
We just don't have it here.
Okay,
And well, we had the cream,
right.
but we got notice this year from the company that they stopped making it
So the
worldwide.
only option is really tablet.
Yes, and there's a tablet, there's a vaginal insert as well, but again, we don't have that in Trinidad.
All right. So, so that's basically the treatments for menopause.
Yeah.
All right.
Yes.
So this is a convenient time again for us to have a little commercial break. And we're going to take a little commercial break, and we'll come back in 1 minute. And at that time, we'll take your calls and your messages. Thanks a lot, everyone.
ACTN The Voice launches a new and versatile culinary series called Stacy's Kitchen. Stacy will be packing up her trolley at Prasad's The Food King supermarket and making a special stop at the Chadak Lane. We will showcase how to make tasty international cuisine with our local products. We emphasize meals on a budget with our selected ingredients. Join us on ACTN on Monday evenings at 6:30 p.m. Don't miss Stacy's Kitchen, exclusively on ACTN The Voice. Munich Home and Garden specializes in hardware, paint, home decor, tools, agricultural supplies, pet supplies, car accessories, appliances, and much more. Located at Val Park Shopping Plaza, Atlantic Plaza, Point Lisas, and Eastern Main Road, St. Joseph. Shopping comfort with our well-secured outlets. Call us at 663-5163 or visit the Munich Home and Garden Facebook page or www.municht.com. Munich Home and Garden, where we make shopping a fun experience.
Keep the popcorn popping, no, we're not stopping. Relax. So you know we in session. Time to talk through, I don't miss a load. Relax. So you know we in session. Don't you deal it, catch me on your TV. Every Thursday, ACTN The Voice in session. Yo, my name is Elisha. And my name is J. Prince. This Thursday and every Thursday at 8 p.m. we are in session.
Our lives feel so different now. School is more intense, work deadlines are shorter, and traffic takes hours every day. Despite all this, I want my family to have wonderful meals and spend time together, just like I did growing up. In my house, it's only Caribbean flavors. I spend less time at the stove and more time with the people I love. Quick, easy, delicious. Caribbean flavors.
All right, welcome back, everyone. Again, you could send in your messages and you could call us. In this segment, we'll answer your questions as best as possible. Dr. Roshni Bissoondat, consultant obstetrician and gynecologist, is with us tonight. And we're discussing menopause. And we've discussed the symptoms, we've discussed the treatment, and we've discussed the treatment in detail. However, I think I missed the side effects of menopause. And thank you for reminding me. And if you could go through that, please.
Okay, so menopause is when you, again, stop seeing your periods and you have that lack of estrogen. Mm-hmm. So one of the common side effects of menopause is prolapse. Now, prolapse can be divided into your womb prolapse and your vaginal prolapse. So womb prolapse occurs because your vaginal tissues become very weak with menopause. And then the other side effects or contributing factors would be childbirth. So if you've had many babies and you've had big babies and long labors, so this makes your womb actually come down, and sometimes it can come out. And less common but very frequent, and a lot of people don't realize, is that you could get prolapse of the vaginal walls where your bladder actually prolapses into your vagina, and your rectum could prolapse into your vagina. And this leads to, well, with what you call a cystocele with the bladder, women get recurrent urinary tract infections, which is common, and they have no reason why they're getting it. So, and it's because when you pee, you don't empty properly. So urine remains, the bacteria is there, and you get urinary tract infections.
Those are pretty debilitating side effects.
Yes,
actually,
yes.
Is it treatment only surgical, isn't it?
Well, it depends on the stage of the prolapse.
Right.
And well, the bowel prolapse into the womb, you get constipation, which it is caused by constipation. And then when you get it, your constipation is worse. So doing what you call the pelvic floor exercises is always your first line treatment to strengthen those muscles to prevent it from getting worse.
What age should women start doing those exercises?
Once you've been pregnant once, that is when you start doing it. So it doesn't matter how old you are. Yes, it's called your Kegels exercises.
All right.
So that's one side effect. The second side effect would be vaginal dryness and difficulty with intercourse. Now, this is important to most couples. So you can't ignore that symptom.
Right.
So things like lubrication, using a simple KY gel, you can use other natural moisturizers, and then hormone replacement therapy also helps with that painful intercourse.
Right.
Weight gain due to your lack of metabolic rates.
Yes.
Women get weight gain, and then they find it difficult to lose the weight. So again, remember, body image is very important for women as well. So this could be a very, like you say, debilitating factor.
Yes.
Osteoporosis, which again we mentioned before, but it's very, very important because osteoporosis can actually cause fractures. So
women may be more predisposed to falls as
you get older.
And a fall could lead to a fracture, which could lead to multiple problems.
Exactly. And we can screen for this.
I'm really glad that you explained this, because this ties in hormonal illnesses, menopause, but actually for falls and people being bedbound and people developing clots in the legs and infections. So it really shows a logical sequence and the importance of this topic.
And if you're at risk of it, you can actually do your bone mineral density scans to check on osteoporosis and whether you need treatment for it.
Right.
Three other minor symptoms would be like.
After you finish those, I think we have some WhatsApps on the line, and we'll take the WhatsApp after you finish.
Okay.
So go ahead.
So cataracts, common, periodontal disease, and of course your mood changes.
All right. Josh, we have any WhatsApp coming in? All right, can you put them up, please? Dr. Roshni, can a woman who's 44 years old, having a child now, risk of becoming menopausal after delivery be more possible? Years old, having a child, risk of menopause after delivery. Right, so after she has a child, is the risk of menopause more possible after delivery?
No,
I would say no.
No, because again, menopause is due to the eggs that you have in your ovaries.
And the fact that she's producing eggs.
So you're born...
Although being 44 is a little bit older.
It's older,
I think that's what the patient is trying to highlight to us. That listen, she's a little bit older, 44 years old. Is she at increased risk of menopause after having a delivery?
No.
That's a wise question.
No, you're not more at risk because the delivery doesn't have anything to do with your ovaries. Because if you're born with 2.5 million eggs in every ovary, right?
Two for every child.
Right, so 5 million, but only 500 ever comes out during your lifetime. So if you look at how many periods you have in a lifetime, it's 500, which means only 500 comes out. Right. So regardless of how many children you have and of your age, if you have eggs remaining, you're not going to go into menopause. You go into menopause when you have all your eggs die away or all comes. So some die away in your ovaries,
Yes.
and the rest come out monthly with your period.
Right.
Once you have no more,
Right.
that's when you become menopausal.
All right.
So again, it has nothing to do with childbirth.
And there's no data in Trinidad as to a menopausal age list.
No,
all our
we
data is based
don't.
on the US.
Yes,
and America.
yes.
That's a bit unfortunate.
Because we have quite a lot of women over 52
Who still having a
still having
menstrual
periods.
cycle, yeah.
Yes,
Trinidad is a little bit
55,
unique to other
56.
countries.
Yeah.
Yeah. And that's a pity. Josh, is there any other questions up? Okay. Dr. Bissoondat,
this is a good
how
one.
long does menopause last? I am 66 years old and have been in menopause for about 20 years. I still have severe hot flashes, and night sweat. When can I expect this to end? Wow. So that sounds like someone is still suffering from the symptoms of menopause. And it's unfortunate because this lady's been suffering for close to 20 years.
Yeah.
So before you answer the question, I'd just like to recommend to that lady to please go and see a gynecologist or your GP, because there is help.
Yeah.
Maybe you did, but there certainly is help, and there's experts who could help you, and there's options. It's very sad to hear someone's not really been suffering for 20 years. What advice would you be able to give that lady, Dr. Bissoondat?
So, and this is a good question that I get asked all the time.
Yeah.
So once you become menopausal,
Yeah.
you are actually menopausal for the rest of your life.
Right.
You don't go out of menopause.
Right. But there's ways to help you with your symptoms.
To help with your symptoms.
Right.
So as you're saying, as she said, she's 66 and she thinks she's been in menopause. You don't leave menopause, and many people ask me this. They say,
Yes.
well, how many years will it last? So from the time you become menopausal, you're menopausal until you pass, basically, for the rest of your life.
Right.
That is menopause.
So I suppose that person who texted, that lady who texted at 64, she would still have options available to her in terms of treatment.
Yes.
Maybe not HRT so much.
I mean, HRT would still be an option, and we actually do genetic testing.
Right.
And it's available in Trinidad to give you your risk of whether if you're frightened about breast cancer, you can do genetic testing.
Right. So that brings back the point of individualized treatment for individualized patients. So nowadays in medicine, and it's very important for our viewers at home to know, we move in towards very much, and this will be the future of medicine, very much stereotype, individualized, personalized treatment of all medical conditions, basically. So what you're saying is that this lady, even though the guidelines or the books or the internet might say, listen, at this age, there's no real option, don't take HRT. What we are saying in medicine nowadays is that, hey, we care about you as an individual, and we are ways that we could test you as an individual and see your risk. And then therefore treat you.
Yeah.
So it's not like a blanket answer
not at
for all.
all.
And I think that's the problem with a lot of women's health in the past, in my opinion. I think that people saw it as like a blanket sort of treatment for everyone. No HRT, or it's bad. Or that's and a little bit of that pointed back to my training when I was in medical school as well. I'm glad that you brought that up. So if you could just give us some final recommendation to that lady who's 64, because I am conscious that this lady is suffering.
Yeah, it's unfortunate. She actually had symptoms for so long, because some women have no symptoms. Some women will have it for a year or two. But unfortunately, she's having it for 20 years. So again, probably you need to see somebody about using possibly one of the natural remedies first. And then if that doesn't work, then you may need to go into the medical HRT.
After checking for all those different risk factors.
Risk factors. And again, it's about risk versus benefits. Benefit outweigh. If the benefit outweighs your risk, it's not harmful in using something.
That makes a lot of sense.
Yeah.
Josh, is there a phone call or is there another message up there? Can you put up their message, please? And you can leave it up to the viewers. Does COVID affect menopause in any way? Well, that's a good question. That's very topical. COVID it might be hard for you to answer because COVID has only been out.
It's only been out for 2 years.
So what would you say to that?
I would actually say, look, we don't have any data on it right now. I've had some menopausal women saying, well, they got the vaccine, so not COVID
good question
itself.
By the viewer,
Sorry, go on. So it's not the COVID itself, but the vaccine that some women may have had. They feel womb pain. And it's real.
Right.
And I've had one or two with a little bit of spotting, But I can't say, I don't have the data to say, look, it's the vaccine that definitely caused it.
So I think that viewer that sent in a question kind of brings me to ask you about COVID and pregnancy, basically. The cat is out of the bag there. Tell us about COVID and pregnancy. What would your message be to women, a lot of women out there? I remember this particularly during the time of Zika. A lot of women were scared to have babies and were worried about Zika and babies. What would be your message to families out there at home? This is a family station who want to have another kid during the pandemic, or actually, if a woman is pregnant and she's worried, what would be your message to them about COVID, the vaccines, pregnancies, delivery, and the little baby?
Okay,
I mean, it's a real loaded question,
yeah,
but I want to get the message over to those viewers.
Okay, so
you'd address it how best you think.
Right. So so far, the evidence has shown that pregnant women are no more at risk of getting COVID itself. Right?
Are more at risk.
No more.
Risk.
No.
Okay.
So you're just like the general population.
Okay.
But however, if you get it, your symptoms are most likely will be worse.
Why?
Because of how your body's immune system changes in pregnancy.
Okay.
And remember, your heart and your lungs change as well to compensate for a baby.
Okay.
So if you do get, and remember, COVID is a respiratory condition.
Correct. And you have a carrying extra.
You're carrying extra, exactly.
Okay.
So just like the flu.
Okay.
When you get the flu and COVID, your symptoms tend to be worse. You have more incidence of ending up in ICU if you do get COVID.
Okay.
Right? The vaccine so far, remember, we only have data.
A real blank question. All pregnant women get the vaccine for COVID, right?
It is recommended. Internationally, you can take it at any stage in your pregnancy. In Trinidad, we are giving it beyond the gestation of 12 weeks of pregnancy. Okay. Because again, we have to be realistic. We don't know what effects it's going to have on...
So in Trinidad, after the 12 weeks, you're going to get
the vaccine. Yes.
Maybe a little controversial, but is there any particular vaccine that any research?
Well,
whatever vaccine is whatever vaccine.
No, well, in Trinidad, we're only giving Pfizer, and Pfizer did the studies on pregnant women. So that's the vaccine that is being given to pregnant women.
All right. So your advice to women would?
Take the vaccine because, again, the studies have shown if you got the vaccine and you did, compared to somebody who didn't get the vaccine, if both women got COVID, the woman who didn't take the vaccine, their symptoms are definitely worse, and they're the ones that ended up in ICU. You ended up delivering the baby preterm because their respiratory symptoms were so bad. And now prematurity has its own risk because remember, survival of a baby depends on your breathing and your lungs. And babies' lungs are really not mature under the age of 34 weeks. So if you have to deliver a baby early, chances are that baby is going to end up in a lot of problems.
Let's going to leave that point for a second. I think we have a call coming through, and caller was waiting for quite a while.
Okay.
Josh, you have a call? Hello, caller?
Yes, good night.
Good night, ma'am. Please speak up a little bit.
Yes, good night.
Good night, ma'am. You have a question for Dr. Bissoondat?
Yes, I do. I'm querying, I saw on television, I can't remember when, that they said pregnant women vaccinated, they're advised to breastfeed their child up until like 6 months into the pregnancy because there'll be something in the vaccination from before could have an antibody or whatever to help the child while the child is breastfeeding. So I'm questioning if this is taking place. Can the pregnant woman get the booster shot and it'll probably help the baby even more, or is it not wise because it's too early to decide whether a pregnant woman can get a booster shot now?
All right. Roshni, did you get that question?
Yes, I did.
Okay, sure. All right. Thanks, Paula. Dr. Bissoondat will answer your question. Have a pleasant evening.
So, so far, the evidence has shown that if a woman gets the vaccine in pregnancy, she actually forms antibodies, natural antibodies. Those antibodies actually go via the placenta to the baby, and it protects the baby. So the baby actually gets those antibodies.
So more reason to vaccinate.
More reason to vaccinate.
The second part of her question was pretty interesting.
Yes.
I don't know if, Paula, I don't know if Dr. Bissoondat will be able to hang a hat, right? Because it's such a new illness, COVID, but did they get the booster?
I have to go based on medical evidence.
protection.
Yes,
Yeah.
it sounds reasonable, but again, we don't have the evidence and we don't have the information out there right now.
Right.
So we are waiting on the evidence to then
One step at a
recommend.
time.
Yes, to then
One step at a
recommend
time.
if you should get the
Safety
booster.
first.
Yes,
Yeah.
correct.
All right. So that's what. Josh, do we have any more WhatsApp or calls? All right. So I think we. Oh, one more. All right, sneak it in. Oh, that's all right. We'll answer it. Good night. I'm a 56-year-old woman that had a hysterectomy 6 years ago. I still have spotting after intimacy. Roshni, can you give some advice there?
Okay. So more than likely, your spotting is due to what you call atrophic vaginitis, which is the entire wall of the vagina is very thin. It's dry, so that it's friction that causes bleeding.
Makes sense.
You literally get bruised by the friction of intercourse.
And I suppose spotting after intimacy could kind of
It's scary because everybody thinks cancer.
Yeah.
But it because you've had a hysterectomy, you could eliminate that. It's not from you don't have cancer of your womb because you have no womb.
Right.
It is more than, I would say, 99%. It's due to lack of estrogen in the vagina, lack of lubrication.
Right.
So again, there are treatments for that.
Right. Very good. So, strangely enough, we've come to the end of the program. That hour flew by.
Wow. Yes.
Yeah. So, I would just like to thank our guest, Dr. Roshni Bissoondat, for explaining menopause. I hope you at home enjoyed it. It was a topic that I really wanted explained thoroughly to our viewers at home. And I would just like to thank Dr. Bissoondat and to say that Dr. Bissoondat will be back in with us next week. I'd like to thank my production crew, Josh and Giles, who did an excellent job this week. And most importantly, I'd like to thank those who called in and sent in messages. It's because of your questions and your bravery of sending in questions and interacting with Dr. Bissoondat that many people out there learn from the general topic. And we thank you for sending in those questions and calling in. To you, our viewers at home, have a pleasant evening and thank you for joining in. Thank you very much. Good night, everyone.